Welcome to WMTR's Ask the Expert with Julie Briggs. To have your questions answered on today's topic, call 973-267-WMTR. That's 973-267-WMTR. Now here's Ask the Expert host, Julie Briggs.
Welcome to Ask the Expert on WMTR 1250 AM, WMTRAM.com, and TalkStreamLive.com on our Sunday morning political roundtable discussing and dissecting the issues New Jersey is talking about. I'm Julie Briggs. Jesse Fries and I host the award-winning Your New Jersey Connection and Ask the Expert, the longest-running ahead-of-the-curve talk shows on the station and in the state. And we invite you to call in and express your views by calling 973-267-WMTR. The most common cancer in men and women is skin cancer. It accounts for nearly half of all cancers in the United States. There are approximately 400,000 newly diagnosed cases a year. Despite what we know about the damaging effects of too much sun on our skin, Americans will spend hours and hours basking in the sun's rays. What are the risk factors for skin cancer? What are the signs and symptoms of skin cancer? And where is it most likely to occur? How can one tell if a mole isn't normal? What is a melanoma, the cancer President Reagan's daughter died from? And is it curable if detected early? We're going to be talking about this and so much more. Also, how to look young and stay young. Joining me this morning on Ask the Expert, Dr. Lisa Coppa Breslauer, MD, board certified in general and cosmetic dermatology, head of the Laser and Skin Institute in Chatham, New Jersey, and a graduate of Cornell Medical Center. Dr. Lisa Coppa Breslauer will talk about prevention and early detection of skin cancer, sunscreens, wrinkle and facial brown spot removers, and how to have younger-looking skin, and so much more. Good to have you with us, and it's so nice to have you back, Dr. Breslauer.
Thank you very much, Julie. It's nice to be back.
What is melanoma? How does it differ from regular basal cell?
When we talk about skin cancers, there are two different types. There are the melanoma type skin cancers and then the non-melanoma skin cancers, which are the basal cells and the squamous cells. Basal cells and squamous cells, and I'm going to speak in generalities, are typically caused by excessive ultraviolet exposure. Basal cells and squamous cells derive from the top layer of the skin, the epidermis. They tend in the beginning stages to grow locally and cause local tissue destruction, and only when quite large or quite advanced do they have the potential to metastasize or spread to other parts of the body. So they are of the types, non-melanoma and melanoma type skin cancers, the less aggressive form, but not to be ignored. And it doesn't mean that it's a non-aggressive. Melanoma-type skin cancers can be caused by excessive sun exposure or sunburns, but there's also a genetic component, and there are some other environmental factors that can contribute to it. And melanoma-type skin cancers can be much more virulent and much more aggressive, and they have a higher risk factor to them as far as morbidity and mortality goes.
Well, they can also be found anywhere. They can be found in the middle of your toes.
Absolutely.
Now, and that is not hitting the sun, so it's not necessarily from the sun, obviously.
Exactly, and that's why I was saying there are other factors besides ultraviolet exposure. They can be found in the scalp, on the bottom of the foot, in the genital region. I mean, areas where the sun never shines. So it's a much more risky skin cancer.
And how dangerous is it?
Melanoma can be lethal if it's not caught early.
How early is early enough?
Melanomas are graded based on their depth where they're found in the skin. So early means if you can catch a melanoma when it's in the epidermis, which is your top layer of skin, before it's actually even gone down into the dermis, which is the underlying layer, that's considered early. So most people will get a diagnosis of melanoma in situ, meaning it's encased in that top layer. That's considered an early diagnosis. Once melanomas become invasive, quote unquote, or has begun to progress into the underlying layers of the skin, that's when it has the potential to be a little bit more virulent.
And what do you do at that point?
It really depends on the depth of the melanoma. So depending on the depth, you might be able to treat it with just surgery where it's completely excised. Some patients may have to have surgery and then a lymph node biopsy to see if it's spread to a lymph node. And then there may even be adjuvant therapy such as interferon or other chemotherapeutic agents depending on how much it's progressed.
Senator John McCain had melanoma,
Yes.
is that correct?
Yes, on the side of his face.
And he caught it early enough.
Exactly.
There's still signs of the melanoma. Is that?
Well, the thing with melanoma is that it has to be, even in an early stage, widely excised. So you can see on Senator McCain's, the side of his face, the left side of his face, the extent of the excision. It's very wide and very deep. And I don't want to speak to his particular case because I don't know the particulars, but I'm assuming that they probably biopsied a lymph node or did something because it just seems like he had very extensive surgery, which is common even for early melanomas.
So when patients come into your office and they say, gee, I don't know what this is, and it could be basal cell, it could be melanoma, you look at it and you think, do you ever get very nervous about what you see?
No, I don't get very nervous.
I would, as being a patient.
But you try to be logical about it, given its appearance. And if there's any doubt or any question, the biopsy is the safest bet.
Are there people that, I should really rephrase that, are there people that come in and just, they've been sitting on something for forever on their face or wherever, thinking it was nothing, and they come in and you say, gee, this has to be biopsied, and that's what I'm saying.
Oh, absolutely. I've seen patients who, denial is more than a river in Egypt. I've seen patients who have had horrific skin cancers that are obvious to anyone walking down the street, and they've just ignored it, believing that it was something that was going to heal or was going to go away. And oftentimes most people will come in even with small early skin cancers and they've noticed the first sign of it at least 6 months prior, and they just kept thinking it was going to heal.
Well, your office just recently moved to, and it's, 417 Main Street in Chatham. It is gorgeous, and I've been in there, and it is, because it's not only offices for your patients, but it's also where they can go in and just relax and get facials and all kinds of other things to make them look beautiful.
Well, thank you for the compliment. We really tried hard to make it not a traditional medical facility, to make it something that was a more calming experience. So whether you were coming for medical or aesthetic procedures, you had a nicer experience.
Well, when I went in and I was waiting for you, I thought, you know what? I don't mind how long you take. This is just so relaxing. The music, it was just quite an experience. Oh, we've got lots of callers. When we return, we have to go to a break. And we're also going to go over some myths that you put out on your newsletters. Myth 1, a sunburn does more damage than a suntan. And I was very surprised about that. We're going to talk about that and take your calls when we return. 973-267-WMTR. I'm Julie Briggs talking to Dr. Lisa Coppa Breslauer. We'll be right back.